The use of mobile phones to communicate with clinicians to decrease alarm fatigue in relation to IV pumps. My name is Caitlin Mann. In the past 5 years, alarm fatigue, or desensitization to alarms, has consecutively been ranked as one of the top safety hazards for patient care. Alarm fatigue often leads to the failure to recognize the alarm due to the constant exposure, as well as a cry wolf phenomenon in which a large majorette are false positives, as stated by Murray State University, 2017. In an effort to provide a positive healing environment for patients with less alarms, having an application on your phone from work or your smart watch or mobile phone linked with your patient's IV pumps with a 5-minute warning would decrease the amount of IV pumps going off and lines running dry. Nurses spend most of their time silencing alarms, whether they be call bells, bed alarms, IV pump alarms, or monitor alarms. Every day, nurses get a slew of alarms, whether it be for all of the things listed or anything else. And it takes away from patient care for us to be constantly silencing these alarms, as well as just taking care of them. Our evaluations would be to evaluate the effectiveness of the use of these devices would be patient care surveys and the response time of an IV ending and if the pump beeped or if the nurse was present before it happened. Nursing and ancillary staff doing reviews of the product, if it's adequately working or not, and less time spent canceling pump alarms and less alarm fatigue noted by staff. Our objectives would be to incorporate technology to cross over with a clinician's smartphone or work phone to overall reduce alarm fatigue, to identify the safest way to do this while protecting the patient's private health information, and to integrate the technology to be a voice rather than alarm to reduce alarm fatigue. It could also be a text message or something of that nature as well, just something that isn't an alarm. Some risks and benefits we'll go over. Some risks would include patient confidentiality, if the clinicians can use their mobile phones, a lack of urgency with certain alarms that do go off, lack of understanding by the staff, and malfunction with the technology like there is with any other technology. Benefits would be less alarm fatigue, an ability to have alarms set for when your patient is on a continuous drip and having the medication adequately ready from pharmacy, and less time spent going to the patient's room and going back and forth to the medication room when alarms are going off and bothering patients. Some methods would be introducing smart IV pumps to all hospitals that interface with the electronic health record. And integration use of IV pumps that communicate with a phone or other mobile device. The results to this, the main goal would be that the implementation is patients sleeping more at night, less alarm fatigue via staff, and improvement of nurse and patient satisfaction with the care given. This has been trialed in a few places but can be widely implemented to help reduce alarm fatigue at the bedside. And here are my references. Thank you.